What if a single breakthrough could turn the tide of a tragedy, saving lives, healing scars, and transforming the future of burn care forever? Meet Professor Fiona Wood, the woman who turned science into hope. Professor Fiona Wood AO, a pioneer in burn care and medical innovation. Professor Fiona Wood was born on the 2nd of February 1958 in Herne, Yorkshire, England, and grew up in a modest mining village. She was the third of 4 children in a working-class family. Her father was a coal miner, and her mother was a physical education teacher. Despite the lack of material wealth, her upbringing was rich in discipline, resilience, and the value of hard work, qualities that would come to define her life and career. As a child, Fiona was energetic and athletic. She initially dreamed of becoming an Olympic sprinter, even training in athletics as a teenager. However, her career aspirations shifted after being inspired by her older brother's studies in medicine. Determined to make a difference in people's lives, she decided to pursue a career as a doctor. Wood was accepted into St Thomas's Hospital Medical School in London in 1978, at a time when only a handful of women were admitted. She graduated in 1981 with a Bachelor of Medicine and Bachelor of Surgery, and completed her early medical training in London hospitals, where she developed a growing interest in plastic and reconstructive surgery. In 1987, Fiona moved to Perth, Western Australia, with her husband Tony Kierath, an obstetrician and gynecologist. She undertook further surgical training and in 1991 became Western Australia's first female plastic surgeon after gaining her fellowship from the Royal Australasian College of Surgeons. At that time, the field of plastic surgery was male-dominated, but Fiona's talent, determination, and passion helped her overcome institutional barriers. During the 1990s, Wood began working at Royal Perth Hospital and Princess Margaret Hospital for Children, where she encountered burn victims of all ages. Treating burns, especially in children, deeply affected her. She realized that while survival rates were improving, the long-term physical and psychological effects of burns, particularly scarring, remained devastating. This realization sparked her lifelong mission to improve burn care and reduce scarring. In 1993, Fiona co-founded a tissue engineering company called Clinical Cell Culture with scientist Marie Stoner. Together, they developed a world-first treatment known as spray-on skin. This revolutionary technology involved taking a small biopsy of a patient's healthy skin cells, cultivating them in the lab, and then spraying the cultured skin cells directly onto the wound. Previously, skin grafts required large areas of donor skin and could be extremely painful, especially for severe burns. Spray-on skin offered a faster, less invasive, and more effective alternative. It accelerated healing, minimized scarring, and significantly reduced recovery time. Fiona and Marie's innovation was initially met with skepticism, but later gained international acclaim after it was used during the 2002 Bali bombings, which killed over 200 people and injured many more. Fiona was part of the emergency team at Royal Perth Hospital that treated 28 severely burned patients, some with burns over 90% of their bodies. Her use of spray-on skin helped many of them survive against the odds, earning her widespread recognition. Professor Wood has held numerous leadership roles throughout her career. She is the director of the Burns Service of Western Australia, overseeing care at Fiona Stanley Hospital, Royal Perth Hospital, and Perth Children's Hospital. She is also a Winthrop Professor in the School of Surgery at the University of Western Australia. In 2003, she co-founded the Fiona Wood Foundation to fund and conduct research into scarless healing and better burn treatments. The foundation brings together scientists, clinicians, and patients to improve outcomes across the entire burn care journey, from injury prevention to psychological recovery. Fiona is also involved in training the next generation of surgeons and researchers. Her leadership in the medical field has helped elevate the standard of care for burn patients in Australia and around the world. Professor Wood's work has earned her national and international recognition. Australian of the Year, 2005. Awarded for her exceptional contributions to medical science and her leadership in the wake of the Bali bombings. Order of Australia. First appointed a member in 2003 and promoted to Officer of the Order of Australia in 2024. Most Trusted Australian. voted Australia's most trusted person in a Reader's Digest survey for 6 consecutive years. National Living Treasure, named one of Australia's national living treasures by the National Trust. Fiona continues to be deeply engaged in medical research. One of her key areas of interest is the long-term health impact of burn injuries. Recent studies led by her team have shown that even minor burns can drastically affect life expectancy, increasing the risk of cardiovascular disease, diabetes, and early mortality. Wood has advocated for a more holistic approach to burn care, addressing not only physical healing, but also emotional and social recovery. She emphasizes the importance of psychological support for patients who may suffer from body image issues, post-traumatic stress, and depression long after their physical wounds have healed. In public health, Wood supports burn prevention initiatives, especially for children, who are most vulnerable to burns in domestic environments. She has backed education campaigns on hot water safety, fire risks, and first aid responses to reduce the incidence and severity of burns. As one of the few women in her field when she began her career, Fiona has been a strong advocate for women in surgery and STEM fields. She mentors young professionals and frequently speaks about the importance of gender equity in medical leadership. She has publicly acknowledged the challenges of balancing motherhood, she has 6 children, and a demanding career in medicine, but also underscores the importance of strong personal support networks and societal change to allow more women to lead in science and health. Fiona Wood's impact on burn care is often compared to that of the pioneers of antibiotics or organ transplants. Her approach blends compassion, innovation, and scientific rigor, and she consistently stresses the importance of research translating directly into better patient care. Her personal motto, a scarless future, summarizes her mission. She envisions a world where survivors of burn injuries do not carry their wounds for life, either physically or emotionally. Through her foundation, clinical practice, and ongoing research, she is working to make that vision a reality. Beyond the operating theatre, Fiona is an inspiring figure, a symbol of perseverance, humanity, and brilliance. She has shaped not only Australian healthcare, but global standards of burn treatment. Her life stands as a testament to the power of one dedicated individual to change the world for the better. If you found Fiona Wood's story as inspiring as we did, don't forget to like, subscribe, and hit the bell icon for more untold stories of remarkable Australians who've changed the world, one idea at a time.